taking a break from cooking to talk about something new, something really cool happening in our area. We're talking about IV-free cataract surgery with Dr. Matt Thompson from Tower Clock Eye. Good morning, doctor.
Thanks for having me on.
Thanks for being here. So I think a lot of people put surgery in general off and cataract surgery as well because it can be scary and nobody likes needles and things like that. So let's talk about the way you guys are doing it now.
Well, people really want to be relaxed and comfortable when they're having anything done.
Right.
And the goal is to give people medication to help with that. And traditionally, people would get an IV and get the medication that way, but we found over the past couple of years that you can give people medication under their tongue, and it absorbs very quickly. People feel very relaxed and comfortable and avoid the discomfort of an IV.
And of course, I'm sure the patients are pretty thrilled about this whole thing.
Absolutely. You know, anytime you can avoid some discomfort, that's a good thing. There are, of course, some people that are worried that that medication might not be enough, and we still have the option of giving them an IV if the medication under the tongue isn't strong enough for them to feel comfortable.
And so let's talk about downtime, because I think that's another thing that people are nervous about. They've been putting off, you know, they know they need to get this surgery. They've been putting it off because they're not only worried about the surgery itself, but just the downtime related to it.
Right. Usually after the procedure, people are kind of sleepy. They want to go home and take a nap and just take it easy that day. Most people can go back to their work and activities the next day like normal.
Well, and how about the vision?
Vision usually takes 2 or 3 days to come around. You can see, but you can't see perfectly clearly until a couple days when the swelling goes down. But because we only work on one eye at a time, usually you can function, drive, work, do everything you need to do.
And then after those few days, what do you hear from your patients?
Well, I hear it so often it almost becomes routine, but people always rave about how the colors look brighter, more clear. A lot of people that have very thick glasses need a lot less correction, and people are usually very happy with the results.
How do you know if you might be, need cataract surgery?
I think the most common thing that people notice is they start having trouble driving at night. Occasionally it's trouble reading fine print, but night driving is really a challenge, especially if it's raining or something like that. And people know they need to do something in order to feel safe.
We were talking about this, I think that that's seeing the eye doctor on a regular basis is something that most of us put off. We may go for our regular checkups, but when's the last time you had your vision checked? And insurance covers it. It's so important, and it just is.
Absolutely. We're not scary. See us every once in a while. If you're in your 60s or 70s, every year. If you're in your 40s or 50s, every couple of years. But make the time to come in and see us and make sure your eyes are staying healthy.
Absolutely. How can people get a hold of you, find out more?
They can visit our website, or they can call us at 499-3102.
And the website?
TowerClockEyeCenter.com.
And as you can see, they're nice people there. So thanks so much for joining us. Appreciate it.
Thank you.